what is PCOS? Polycystic ovarian disease. Let's discuss about this. This is Dr. Archana, consultant gynecologist from Ragavi hospitals. Let's know what is PCOS, which is commonly seen in all age groups, starting from menarche to menopause. When should it be addressed? What are the risks and how can it be avoided? First, PCOS, polycystic ovarian disease. What does this mean? This means in your ovaries, they grow bulky and there are many follicles growing in that. So how does this happen? When should it be a problem and when should it be addressed? There are irregular periods. So when do you call a normal menstrual cycle? When you have regular cycles of 25 to 25 days and you have a flow of 4 to 5 days of 80 ml together and there is no pain and there is no heavy flow or associated with clots, then you call it is a normal menstrual cycle. When any deviations in these, you call it abnormal menstruation. So when there are abnormal menstruation and there are irregular cycles to the patient, they need address. So when should this be done? This can be differentiated into different age groups. When there are period problems in the early age, so usually it is hormonal imbalance. PCOS means it's just not a disease. It is just the lifestyle variations which needs to be done and it can be addressed very easily once you adopt these changes in your lifestyle. What do? They include exercise. Don't be sedentary. Keep walking. Stretch yourself. Take an exercise. Try to include this exercise in your daily routine. Avoid junk food. Don't take fried foods. Have food on time. Do sleep regularly for 6 to 8 hours per day and have proper time schedule for your diet. With these simple things, minor hormonal changes can be addressed in a case with PCOS. Once these minor changes are done, your periods will become regular automatically. But if these don't work and they face a lot of problems like heavy bleeding and periods not getting periods for 3 to 4 months in a row, then you need to address the patient and give some treatment and support them by giving hormones externally. With this, usually most of the people they improve themselves and they get normal periods. Usually PCOS means not just irregular menstruation. There are other changes also observed in the girl. They include abnormal hair, hirsutism, blackness over the neck, we call it acanthosis nigricans. All these features also can come for a lady with PCOS. When these all occur, there are severe hormonal changes and they should be addressed for that particular patient. So when these can be associated with, in case of a reproductive age, they can be associated with infertility. They may face difficulty in achieving conception. So what should be done in that cases? We need to regularize the periods, treat the symptoms, help the patient with, if needed, with supportive treatment, and then maybe they can plan for a conception. This is how PCOS is different in each people, ranging from menarche to menopause. It depends when to address, how to address, depending on the age of the patient and the symptoms which the patient faces during this. So nothing to worry if I have a PCOS. It can be treated, addressed, and very easily patient can go happily with normal menstruation or normal cycles when they face this problem. So never get be worried when you have a scan diagnosis showing PCOS. Do come and visit a gynecologist so that we can help you and you can get well soon. Thank you.